Doctors say that testing could be the key to stopping the spread of COVID-19.
But if you want to get tested in Minnesota, it is not easy. It's very limited. So why is that, and how might it change? Heather, you looked into this this week, and we're really seeing the test focused on what? On healthcare workers?
Right.
Yeah.
People who are in the hospital right now currently, and a group home. So, for example, nursing homes right there. And for a lot of people, I think this is frustrating because they may have symptoms. Maybe they're coughing,
Sure.
maybe they have a fever, and they want to call their doctor and say, can I just get a test? Will you just give me a swab? And at this point, the doctors and the healthcare facilities are saying, no, we can't. The Minnesota Department of Health has asked us to limit it to those specific populations. And there's a good reason for that, and that's because they're really running short on the supplies.
So what, are we short of supplies, or is it that we don't have enough labs to run these tests,
Right.
or is it all of those things?
So right now, the tests are being run here in Minnesota at the Public Health Lab in St. Paul. This is the Department of Health. At the U, at Mayo, at Hennepin Healthcare. Allina hopes to start running their labs at the end of the month. But we also have 6 public labs. These are huge labs across the country that are able to run these tests. But there's a bunch of issues that are happening that they can't get to these tests as quickly as not. They can't ramp up very quickly. And 2 of those reasons are, one, we're starting to run out of the swabs. You've probably seen that video of them sticking the swab right up your nose. The other is they are looking for reagents. They're the chemicals that are actually used to do the tests, and they're running on short supply there.
It's a bummer because the best way to try to deal with this in a more surgical manner
Right.
would be if we could isolate people who don't have any symptoms,
For sure.
but are positive. So
Right.
right now we've shut down the entire state because no one knows who might have COVID-19 or not.
Right. And that's the problem. And it's very frustrating for health leaders in the state. It's very frustrating for the governor because they would really like to see more testing going on, not just testing of of the swabs, but also that blood test that we've been talking about in the
Right,
past
the
that can kind of figure out the
antibodies,
antibody test that sort of figures out what's happening afterwards. You might see video of these drive-up testing sites in New York. Well, what's happening there is New York has, their problem is just so much larger than our problem here. So the supplies that are out there, the national vendors are sending a lot of those resources now to the hot
Sure,
spots.
as they should. And in New York, they're testing about 1 in 88 people.
Right. Yes.
That's good. I will say, I'm a little surprised by how many tests have been run here in Minnesota when you look at the fact that we have 700 plus cases.
Right. I was running the numbers yesterday. We have tested 1 in every 250 Minnesotans. And so, that comes to about 22,000 people. And a lot of those, of course.
That's a lot of tests.
That's a lot of tests, and they're continuing to ramp up. If you do get a test, a lot of it is kind of being done at Mayo. They're really the ones that can kind of ramp up the most.
Yeah.
But what you're going to see is these quick tests coming out. The president introduced one, I think it was 3 or 4 days ago now. But still, even that test, when it comes up, it's still at first going to those frontline workers.
Yeah.
So I asked the Department of Health, and I asked everybody I talked to on this story, is there a time that you foresee that anyone in Minnesota who has symptoms who wants to get a test will be able to get one? And nobody could give me a good timeline.
Yeah. It's probably never going to happen. But.
Yeah, or it could be months from now,
Right.
and then things will really have changed by then.
Sure. All right. Yeah, big question. There will be a
Yes.
lot of examination of this as we get through it.
Right.